Good afternoon, everyone. Thanks so much for joining me today. I'm Jennie Montgomery. Welcome to another half hour of information to help you make the most of your time, to make informed decisions, and to keep up with goings-on around Greater Augusta. Breast cancer, you know, will affect 1 in 8 women. That's the statistic we have to drive home during October, Breast Cancer Awareness Month. That's why cancer patients and volunteers gathered recently at the U.S. Capitol to convince Congress to once again make the fight against breast cancer a national priority. Here's one cancer survivor's story as she pleads her case to lawmakers. Hearing the words, "You have cancer," upended Marcia Earle's life.
It happens so quickly that you almost don't have time to be afraid.
A cancer survivor, Earle was diagnosed with ovarian cancer in 2010.
You have to kind of live with that anxiety of, I'm not really sure that's how this is going to come out.
She and others who have been impacted directly or indirectly by cancer lobbied lawmakers on Capitol Hill to continue to make cancer a top priority.
Cancer doesn't care who you are. It touches so many lives, so many people.
Adam Clemens is one. He lost his mother to breast cancer when he was just 7 years old. He's been advocating for cancer patients since high school.
I try to carry on my mother's legacy by sharing my story. It's not the sob story. I just want to keep that legacy going.
The advocate's top priority was to urge Congress to increase cancer research funding by $2 billion at the National Institutes of Health.
It used to be that if you were diagnosed with cancer, it was a virtual death sentence. Now the chances are that you're not going to die of it. We are getting much better at dealing with this disease. I mean, we've made more progress in the last 5 years than we've made in our entire history prior to that.
Dr. Allan Krutchik joins me now. He's a breast medical oncologist at the Medical College of Georgia at Augusta University. And doctor, from your point of view, I mean, those are words that you've had to deliver, and again, I would assume you've been with patients when you tell them you have cancer. What is that like for you? And what is it like for the patient?
Well, it's devastating. So my approach has always been to put the patient at ease, sit down, face to face, not standing, not be in a rush, have the patient get off the exam table, sit across from me, and then I start off with the following. I say, look, I realize this is a devastating diagnosis, but we must think positive. And the other thing I stress, 10 years from now, whatever happens, it's going to be a blur. This will be behind you. And if you need to go through chemotherapy or hormone therapy or radiation therapy, our team will be there. I will be there. I'm available. And I think once we have this kind of communication, the patients are at ease, they're comfortable, and then we get into the discussion of the diagnosis, the stage, and I feel very strongly when patients are educated, the fear disappears. And that's the key thing. My job is to make fear go away and put them at ease and put them in the frame of mind. We're treating this like a chronic disease. Your prognosis is probably going to be very good, irrespective of the stage, because we have so many new therapies. Even in those women that have more advanced breast cancer, I continue to offer the positive predictive model that the future is hopeful. There are new treatments available, even if we don't have them now. And I think just by this approach, patients feel more comfortable because there's so many misconceptions about what breast cancer is, the stage, the treatment, the side effects.
What I'm hearing you say is two things. Don't get hung up on the number.
Right.
And science is on your side.
Exactly. Exactly. And I think when patients hear, as you had said in an earlier segment, in the last 5 years there's been tremendous research. Now, 25, 30 years ago, and I'm dating myself, we would have never had the expectations of what we're seeing today. And that's why oncology has improved dramatically as far as how it's helping patients.
You are pretty new at the Georgia Cancer Center. Tell us a little bit about what that is like. What makes the Cancer Center different?
It's a facility that has all the specialties there, not just the medical specialists, but we have the nursing support staff, and we have psycho-oncology, which is excellent in helping patients get through the stressful periods of chemotherapy and hair loss and other devastating things. And by the way, hair loss itself from drugs should be improving dramatically with new therapies. So I just wanted to bring that point out. And so we have this team approach. We meet in conferences, and we all agree, disagree, and then we come together with a unified opinion. Bring that back to the patient at their next visit, and I think they know that this team is working with them, not just an individual like myself making all the decisions. So this is a crucial aspect of comprehensive cancer care.
I guess it is really good for the patient too to see people working together.
Right.
And like you said, okay, it's more than one opinion. It's not just one person's idea. We've got a lot of minds on this, a lot of eyes on this case.
Exactly. And I will say it doesn't hurt to give the patient a hug once in a while.
Yeah.
I'm from the old school of touch and feeling and giving the patients a sense that there's a communication, not the isolated, ice cold, here's the diagnosis and here's the treatment. That's not the approach at the Georgia Cancer Center.
That's fantastic. And that sounds like when you're going through that, that's exactly that. Human compassion is definitely what you need.
Absolutely.
And you know, it's estimated more than 40,000 women will die from breast cancer this year. That's according to the Susan G. Komen Foundation. The good news, as the doctor says, more people are beating the diagnosis, largely because of better treatment. Some life-saving discoveries are happening right now at the Medical College of Georgia, as Ashley Osborne reports.
Dr. Hassan Korkaya is a tumor biologist at the Medical College of Georgia who studied breast cancer for 16 years.
Spending long hours in the lab and trying to understand what makes the cells, grow first. The second, and the most important, how they disseminate from the primer site.
Recently, his team discovered that a process proven to cause self-destruction in certain cancers can help other cancers survive and even get stronger.
Some tumor cells, not only they don't die when they were treated with TNF-alpha, they become much more aggressive.
They've also found a workaround.
Combine the immunotherapy with the drug that targets this pathway I just mentioned, and then the tumor size was 10 times, maybe 20 times less.
Moving forward, this could help treat some of the deadliest forms of breast cancer.
Hopefully, in the future, this will be our recommendation to clinicians, and perhaps this will be a way to the immunotherapy in breast cancer patients.
Dr. Korkaya's father passed away from cancer a few years ago, so his research on breast cancer strikes a personal chord.
Down the line, if 1 or 10 or whatever women benefit from it, that will be my reward.
And as studies continue, Ashley Osborne, WJBF News Channel 6.
Ashley tells us that right now they're working to develop a drug that will best fight the cancer strengthening process they discovered. And stay with us. Our conversation with Dr. Allan Krutchik continues in just a moment. Plus, coming up a little later on Jennie, how to participate in the area's biggest event for breast cancer, the Miracle Mile Walk. It's coming up this weekend. Stay tuned. The Georgia Cancer Center here in Augusta began treating patients in January. It provides breast cancer care through the area's only multidisciplinary breast health center. The goal is to serve patients through all phases of cancer care, including diagnosis, treatment, recovery, and survivorship. A big part of that is using the most advanced diagnostic tools, including 3D mammography. Dr. Allan Krutchik is an associate professor of medicine at the Medical College of Georgia at Augusta University, and you are a breast medical oncologist. That's a big title.
Yes, it is. It is.
First of all, thanks for your time today.
My pleasure.
So you are involved in research and patient care?
Yes, we have many different programs research-wise. We have our clinic where we actually see patients and treat them and discuss research projects. And we also are involved with prevention, management of complications of the disease, and many other facets of care, including psycho-oncology.
I guess that is a big part of it, because that's emotional care to
Absolutely.
go along with your cancer
Yes,
treatment.
yes, because the diagnosis itself is stressful,
Sure.
and of course some of the treatments themselves lend themselves to stress. So we try and have a comprehensive program. We meet in a multidisciplinary fashion, usually weekly, where the radiation therapists are there, radiation oncologists, the surgeons, the support staff, psycho-oncologist, myself, and it really makes for excellent cancer care.
So that means that you are truly that patient's team.
Yes.
That's really, really important.
That is our goal. We want to make sure that we're all feeding into the treatment plan so the patients get the best possible care.
Dr. Krutchik and I were talking about this before we started this segment. I'm so astounded by, I don't know if it's really a statistic, but it's a phrase that I hear doctors say, and that is that in the last 5 years, in terms of cancer research and treatment, we've learned as much in the last 5 years as in all of history put together.
I think that's absolutely true. There are so many new drugs, targeted drugs, not yet made it into the breast cancer realm, but moving in that direction, which eliminates the need for toxic chemotherapy drugs. We can precisely cater our patients to a specific program of treatment, and this way we treat the disease more effectively and decrease the side effects. Now in breast cancer, we have some research interest that we are pursuing looking at these targeted agents, which are really some of the immunotherapeutic drugs used to treat lung cancer, bladder cancer. We're hoping that that will move into the breast cancer realm.
Right. I have heard of situations with cervical cancer where the immunotherapy for lung cancer can really benefit some cervical cancer patients. So you're hoping that treatments like that, you may be able to find the applications
Yes,
of breast cancer.
Exactly. And there is data that was published this year that showed that there is promise in breast cancer, which is, of course, one of the most common cancers.
Right.
There's 250,000 cases of breast cancer per year in the United States, 1.2 million worldwide. And we have a significant number of patients, unfortunately, that are not cured. So this is the goal by using mammography and other techniques, and now the new therapies, we're finding that things are getting much better for women.
It seems like for so long when we talked about breast cancer, it was a matter of, deciding if it was going to be chemotherapy, radiation, or both, or if you needed to have radiation to shrink before you could do the other, before you could do the surgery. But there's so much more on the menu now than
yes.
that.
As far as the radiation, at our tumor board, we have expert radiation therapists that are involved in national clinical trials, which we are involved with in many aspects of breast cancer treatment and other cancers. This allows the radiation therapist to consider omitting radiation therapy in those women who have early breast cancer, especially older women. And then we have our surgeons there who are now doing much more limited surgery than the usual mastectomy that was 25, 30 years ago, the standard of care. So that's really not the most common procedure these days. They're also able to do techniques that'll limit the amount of surgery into the armpit area, which used to cause significant arm swelling, lymphedema. So all of these new techniques are just phenomenal, fantastic things for patients.
Has it been really amazing for you over the course of your career to see these changes?
I have, and probably the most monumental change came out not too long ago, this past July, where now we're able to select out patients who actually do not require chemotherapy as part of their breast cancer treatment. So that's been huge because many women in the past 10, 20 years may not have absolutely needed chemotherapy, and now this new technique, which is readily available, has eliminated a substantial portion of those women requiring chemotherapy.
Isn't that wonderful?
It's amazing.
Since we are talking about breast cancer, just remind our audience again about the importance of your own breast health care at home and your yearly visits to the doctor.
The first thing is, it used to be thought that breast self-examination was crucial. We've learned that that probably is not the most important thing anymore.
Okay.
Mammography is still the critical mass of determining the diagnosis. There is still controversy about mammography in terms of, do all women who are found to have breast cancer actually have a life-threatening breast cancer? And there are studies now trying to answer those questions. So it's not a perfect study. It has decreased the larger sized tumor to a smaller sized tumor, which leads to cure, and that's a good thing. And it's reduced the death rate by 22%. So there's no question there are benefits. The key point now, and this is where research is directed, can we find women who actually don't need to have mammography, meaning that their breast cancers will never impact their lifetime, or early pre-breast cancers? This is the area of research to avoid overdiagnosis and unnecessary treatment.
So maybe it's there, but it's like dormant?
it's dormant, and if they didn't have mammography, they would have not known about it, they would have lived a normal life.
Right.
That's the targeted group we hope to find through further studies to eliminate and predict who would benefit from mammography.
Fascinating, fascinating. Well, Dr. Allan Krutchik, thank you so much for being with us today and enlightening us on the big advances when it comes to breast cancer and happening right here in Augusta.
My pleasure.
Coming up next, cancer treatment gives patients a second chance, but it can be quite painful. We'll show you how acupuncture is being used to help women deal with discomfort right after this quick break.